Let's look at the movements of the ankle joint. So at the talocrural, or what most people call the ankle joint, you have motions dorsiflexion and plantar flexion. So dorsiflexion is when you lift your toes towards your leg. And there's also a slide and roll, which remember are your arthrokinematics. Your osteokinematics are the dorsiflexion and the plantar flexion. So dorsiflexion is when you put your toes toward the leg. So this is in a dorsiflex position. Plantar flexion is when you point your toes. And these are both open chain movements, right? You're moving the distal part of the body. You can also look at closed chain. So dorsiflexion closed chain is if you go down into a squat, right? So you're going down into dorsiflexion. And then plantar flexion is if you rise up on your toes. All right, moving to the subtalar joint, which moves in the frontal plane and the horizontal plane. The movement of the talocrural joint was only in the sagittal plane. Dorsiflexion, plantar flexion are in the sagittal plane. Subtalar gives us those other two movements in the two other planes. So again, it's the joint below the talus, and you have what we call inversion, which is abduction. So the sole of your foot is pointing out, and you have inversion, which is adduction, with the sole of your foot pointing in. I find it easier to do with both feet. So soles in is inversion, soles out is eversion. Closed chain, you can kind of just push over onto the lateral side of your foot, right? And you can see here, you get a better view. See here, your leg is angled inward and your foot is on the ground. So that's a closed chain motion. So that would be inversion, and the opposite would be eversion. You also have AB and adduction of the toes, which also looks like medial and lateral rotation of the tibia. But we'll first talk about AB and adduction of your toes. So adduction is when your toes are pointing inwards toward the midline of your body. Abduction is when the toes are pointed towards the lateral side of your body. When you move down to your metatarsal phalangeal joints or your MTP joints, you can flex and extend, right? You can flex your toes up and extend. Your hallux can extend quite a bit. And you can also AB and adduct. And again, the center or the midline for AB adduction of your toes is the second toe. Moving on to the proximal and distal interphalangeal joints. Flexion of the toes is this top picture. Extension of the toes is the bottom picture. Then we have these two complex movements. They're multi-joint and multiplanar, called pronation and supination. We've talked about pronation and supination at the radial ulnar joint. This is a different pronation and supination. And sometimes anatomy does that to us, just like we'll see the deltoid muscle and we saw the deltoid ligament here at the ankle joint. But so pronation, there's three movements for each of them. Pronation is a combination of dorsiflexion, eversion of the subtalar joint, and abduction of the toes. Supination is the opposite: plantar flexion, inversion, and adduction. These are natural motions when we walk. When you are walking around and you go to heel strike, your ankle complex will pronate. So you'll dorsiflex, evert the subtalar joint, and abduct. Your toes will go a little out. It's kind of like lowering your arch to the floor. When you're going to push off, when you're walking, you stiffen up that arch again. So you plantar flex, invert and adduct the toes. And so you can kind of see somebody manipulating the foot into pronation. So the arch kind of goes towards the floor, and supination, it kind of, the arch doesn't reform, but engages and is stiff for takeoff. So here's what it looks like if you look from a posterior aspect of a person, right? So here's their lower leg, and here's their calcaneus. You'll see kind of a dropping in of the foot, that's in pronation, and supination, you're moving towards the lateral side of your foot. Again, pronation, this is a neutral rear foot, and supinated. Supination and pronation are normal motions. It used to be that excessive pronation was a reason for a cause of, or a hypothesized cause of, medial tibial stress syndrome or shin splints. That's less so now because the problem is nobody really knows what excessive pronation is, right? Everybody pronates at a different amount. So you can't say like 10 degrees is definitely overpronation and that will cause this injury. So again, when we're dealing with the rehab of people, everybody is individual. But if you are pronating, you might see it in a shoe, right? So you can kind of compare less pronation to more pronation on the left. It will lengthen the medial side of your Achilles tendon, so sometimes you'll have some irritation there. Your arch may flatten, and you may get plantar fasciitis. So that's an irritation of your plantar fascia. And a lot of times, as you can see in this picture, this is not my foot, but it could very well be, you will have hallux valgus, or what is colloquially termed as bunions. Some people get orthotics. I've worn orthotics when I run for 30 years, and it basically brings the ground closer, so it's decreasing that pronation movement on impact.